Medicine and programming may seem like completely different worlds, but when you look closely, they share an important principle: structured decision making. Whether you're a doctor deciding on the best treatment for a patient or a programmer solving a problem with logic gates, the underlying process is very simple. In medicine, doctors often use flowcharts or decision trees to determine the right course of action. Let's take an example. A patient comes in with certain symptoms. The doctor will ask a series of questions. Does the patient have a fever? If yes, are there any other symptoms like coughing or a sore throat? Based on these answers, the doctor follows a path toward the correct diagnosis. For instance, if the patient has a fever and respiratory symptoms, the next step might be to test for flu or pneumonia. But if the fever is present without respiratory symptoms, it might lead the doctor down a different path, like checking for infections elsewhere in the body. Now let's compare this to how a programmer thinks. In programming, we use flowcharts with logic gates to make decisions. These flowcharts contain conditions like if then or if and. Take the same example of a patient with a fever and respiratory symptoms. In a program, this might look like: if the temperature is above 100 degrees and the patient has a cough, then the program suggests testing for the flu. If the temperature is high or there are other symptoms like sore throat, then suggest a different test. These logic gates and or not are the same kinds of decisions doctors make every day. We simply translate them into code. Let's break down these logic gates. In medicine, an in condition means all conditions must be true. For example, both fever and cough must be present to recommend a specific test. An or condition means only one needs to be true. Like if the patient has either a fever or a sore throat, the decision changes. A not condition reverses the logic. For instance, if a patient does not have any respiratory symptoms, the doctor may rule out respiratory infections altogether. Similarly, in programming, the AND gate checks if both conditions are met. The OR gate checks if at least one condition is true. The NOT gate negates a condition, just as a doctor might rule out a diagnosis if a symptom is missing. On one side, we have a medical flowchart where each condition leads the doctor closer to a diagnosis. On the other side, we have a programming flowchart where logic gates guide a computer program toward a decision. Both are step-by-step processes aimed at finding solutions. The parallels are striking. Whether it's choosing the right drug based on symptoms or running code through multiple conditions, both involve breaking down complex problems into smaller, logical steps. So, why does this matter for life sciences students? Because understanding these similarities can make learning to code far less intimidating. If you're already familiar with decision-making in medicine, you're not far from grasping the same concepts in programming. It's just about recognizing that the logical approach you use in diagnosing a patient is very similar to how you solve problems in code. Before we wrap up, here's something for you to think about. Imagine you're diagnosing a patient. They have a fever and a sore throat, but no cough. Which test would you suggest? How would you create a programming flowchart for this decision? Share your thoughts in the comments below. Learning programming as a life sciences student might seem like a big leap, but remember, you're already familiar with logical thinking. The only difference is the tools you use. Now that you've seen the similarities, are you ready to apply this approach to your own coding journey? Leave your answer to the question in the comments, and let's keep the conversation going.